Hello there. Go ahead and have a seat right up there on the bench. My name's Dr. Prim, and I'm going to be taking care of you today, okay? Yes, you are right on time for your appointment. More than enough time to go over everything and get you checked out, okay? Alright, so go ahead and just get comfortable. I'm going to ask you a few questions before we begin the examination, alright? Okay, so we're going to go ahead and start out just with your basic primary information, alright? So, can you verify your first and last name for me? Middle initial, please. Okay, good. And verify your birthday, please. Alright. Okay. And, let me see. Your primary doctor is Dr. Okay. Alright, and since they are out of town today, all this week actually, I'm going to be seeing you today and then possibly for your other appointment in a few days, okay? Alright, good. So, has anything changed with your medication? Alright. And when did you start taking that exactly? Okay. You're following the instructions with those and alright, good. Did you have any questions about any current medications that you're on? Are you having any experiences with them that are any of the negative symptoms or anything? Okay. Alright. So you are here today to get a little checkup on your heart, your breathing, everything. Has everything been okay lately? Are you okay? Okay. And how long has that been going on? Alright. Okay. Alright, so just a couple more things here, and then I'm going to go ahead and I'm going to listen to your heart, listen to your breathing, and make sure everything is looking good, alright? 1 to 10 though, how have you been feeling the last week or so? Okay. And do you smoke? Do any drugs? Okay. Alright, that's very, very good. Okay. And about how often do you exercise? Okay, a few times a week. Alright. That is pretty healthy. Okay. Alright. And I'm just going to have you look really quickly at this information and make sure that it all looks okay. This goes over. Let's see. This goes over your contact information, your address, stuff like that. Okay. And right here, your allergies, anything you may be allergic to, medicine, food, just anything. Okay. Okay, just make sure nothing has changed. Alright. Okay. And anything in your family history, any changes in that over the last few months since you've been here? Okay. Alright. Okay, so go ahead and just relax. I'm just going to start the examination with checking your breathing, checking your heart rate, everything like that. Looks like the nurse already checked your blood pressure, but we might go ahead and give that a look as well. Alright, so I'm just going to just let me feel if anything feels a little off. Your blood pressure actually showed that it was okay, it was normal. So that looks good. I'm going to go ahead and just take a look in your eyes, okay? So go ahead and look up for me, okay? Okay, and I'm gonna go ahead and check the other eye. Let me see. Go ahead and look down for me. Okay. Alright. Go ahead and open your mouth, and I'm just gonna make sure everything looks okay. Okay, so I do see a little bit of redness, but nothing too bad, nothing to be worried about. You might want to get it checked out though in a couple days when you're coming back. Okay. Right, so let me see. Okay, so I'm gonna go ahead and listen to your heart. Okay. Now, you don't have to change the speed of your breathing or anything like that. I just want you to breathe how you normally would. Okay, just breathe completely normal. Okay. Okay. All right. Yep, just stay relaxed. You're doing fine. I'm gonna go ahead and reach around and go ahead and listen to the back. Okay. Okay. Alright, so everything sounded really good. I'm going to go ahead and have you take some slow, deep breaths in when I tell you to. And just breathe through your mouth and then breathe out through your nose, okay? Okay, and breathe in and out. Okay, and in again. And out. Okay. Okay, I'm going to go ahead and check the back. Go ahead and breathe in and out. Okay. And in. And out. Okay. Okay, so I'm going to make a few minor notes in here. You did excellent. Everything sounds good, so you have no worries, okay? I do want you to get your throat and everything checked out in a couple days when you come back, just to make sure you're not developing any type of sinus infection or anything, okay? Alright, go ahead and highlight a few things we're going to come back to next time you stop by. Alright, so since your breathing and everything sounded good with me, I don't think I'm going to recheck your blood pressure just because the nurse checked it a couple times and every time it came back really good. So, I think everything is fine. No changes in your medicine. I don't see any reason to change up anything. Everything seems to be working fine, okay? So that is a good sign. Just keep up with your weekly exercises, keep up with your breathing exercises, okay? Do you practice any breathing exercises? Okay. Yep, just keep doing those and keep taking your medicine, your prescription medicine. Make sure you are following the instructions, okay? You're doing a really good job. You should be very proud of yourself, okay? Alright, so do you have any questions for me about anything we went over today? Are you experiencing any changes with anything throughout your body? Anything that you'd like to talk about or discuss? Okay. Alright, and let's go ahead and figure out when you're gonna be coming and seeing me. I know you're supposed to come in a couple days, but is there any certain time that you prefer? Well, I have you down here for 4:30 p.m., but I know schedules change and everything throughout the months, so has anything changed that you may need to schedule ahead of time or maybe a little bit later in the day? Okay, yeah, we can move it up to 2:30 p.m. if that would work better for you. Okay. Alright, and that is just an overall checkup. Okay. And I already put down in the notes that we're gonna really try to look at your sinus area. We're gonna try to make sure you're not developing any type of illness, okay? There are a few different bugs going around. Okay. Alright. Okay. And do you need any type of doctor's note saying that you've been here today? Okay, no problem. I can write one up. It'll just take a few minutes. Alright. And just let me sign in here really quickly. Okay. Okay, and actually, there is a notification that you have a refill in ready at your pharmacy. Okay, if you'd like to pick that up today. Alright. Let's see, what time is it? Okay. Okay, and is this for school or work or any type of particular meeting that I need to include in the note? Okay. Alright. And how do you spell that? Okay, that's what I thought. I had a cousin that used to work there, but it's a funny name. You don't hear it every day. That's for sure. Alright, I think that looks good. I'm gonna go ahead and send it to our printer, and you can pick it up on the way out, okay? Make sure just to sign your name, and they will give it to you. Alright, well, it was really good meeting you today. I guess I will see you back in a couple days. We will continue the examination and make sure all the ducks are in order, okay? Alright, I'll see you then. Okay, take care.